All right, good evening, everyone. This is Dr. Schilling from Secoya Health bringing you this week's Wednesday Wellness Minutes. And this week we have the distinct pleasure of having Doug join us. Doug is a participant with us, and just so you have an appreciation for how we can use pulsed electromagnetic field therapy, or PEMF as we refer to it, in terms of systemic challenges. We use it generically because Facebook, of course, blocks anything we talk about condition-wise. But what I'd like to do is start off with having Doug just mention a little bit about what he was dealing with before he came to see us at Secoya Health.
I have had chronic Lyme's disease. Some of the challenges that I've had because of chronic Lyme's disease is brain fog issues, equilibrium problems, chronic joint aches, chronic fatigue syndrome. I've had a hard time staying awake at times, and some digestion issues.
Okay.
We tried treating it with drugs in the past, and that hasn't been successful overall.
Gotcha. Okay. And this is pretty typical of someone who has been down the medical road as far as trying to heal from a chronic systemic challenge. The medical establishment tried to label Doug with Lyme, and as you know from working with us in the past, Lyme is a town in Connecticut. So we always talk with our participants about ditching the diagnosis and leaving behind those stigmas or the labels, because we want Doug to live up to his greatest expression, to feel his best, rather than living down to some type of label that they put on him. So we would describe what Doug is challenged with as multiple systemic imbalances. Some people call them infections, we call them imbalances. One thing we've talked with Doug about is not focusing on eliminating or killing off something. It's really about balancing things, because these bugs that are in our bodies have been around for millions of years. And as a result, they're adaptable. Like, they'll hide in your joints, in our brains and stuff like that. But as long as our immune system is strong enough, we don't have to worry about it. It's no big deal. So getting back to what we want to focus on tonight, which is PEMF. Now, so Doug mentioned circulation issues, energy issues, and things like that. So for example, Doug is sitting in the chair. What you may not know is these pads underneath, under the feet and under the back and stuff like that, as well as circle pads, and we've got some rings down here. Okay, there are a lot of different attachments we can use, and that affords us the opportunity to focus on different things at different times. So, for example, when someone comes in with chronic fatigue, you always want to think of the kidneys as basically the power pack in your body. If your kidneys are weak, if you have low back pain or you're peeing a lot and stuff like that, your kidneys are challenged. Okay, so you need to support them. So, for example, depending on how we'd want to focus on this, we would basically slide these behind the person, in this case Doug, and then he would lean back, and we'd have the power of the pad, and then the paddles behind his low back. For example, I woke up at about 3:50 this morning and realized, I'm sweating, not feeling so hot, so I jump in my car and drive over here. Fortunately, I live 5 minutes away. So I was sleeping on the bed back there for about an hour and a half this morning before I had to go back home and get my kid out of bed. So that's how I operate. Sometimes when I don't feel so hot, you just charge up, and then you get back on track. But in this case, we need the kidneys to be strong, okay? So we need to charge those up. And so I won't fire it up now because you'll have to hear it, and it'll be going tick, 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 depending on how many pulses per second. But this is a way you can focus on the kidney itself, get energy in there, charge up the cells, and put energy into them, activating what are called the mitochondria and getting the cells working better so that the kidneys can drain the toxins out instead of being constantly irritated and dumping stuff down into the bladder, causing us to wake up a bunch at night and go in the bathroom. So that's one example. We'll slide these out. For digestive issues, and for the sake of this example, I'm not going to have Doug pop to the bed and back on the table, but we would, for digestive issues, we'd put them over the digestive system. And typically we use Velcro to keep people so they don't have to hold on to them. We want as much surface area covered as possible, so that's why when Doug's here, we strap him in, per se, go for a ride in the PEMF chair. But this will stimulate the digestive system, activating the microbiome, the bugs in our gut, the helpful ones that are helping us, and it'll help balance out the ones that are imbalanced. Okay? For, in this case, equilibrium and hearing challenges. Now, it's not uncommon that we face challenges, okay? So if we have a problem on one side of our body versus another, it's always a key. If you've ever have a condition in your body, there's always a reason behind it, okay? So if you know anything about Chinese medicine, generally speaking, the right side of your body is masculine, left side is feminine. So when we have problems on the right side, it's usually masculine related, whether it's an internal masculine conflict that Doug and I might have, or if we have a challenge with a masculine figure in our life outside of us. If we have one on the side, on the left side, it might be a female, a spouse, a partner, a mother, something like that. So, for example, if I had an ear challenge, we'll just use Doug as an example. equilibrium challenges. Mentioned that at night sometimes you feel unstable when you wake up. Okay, so that's a vestibular. Okay, that's a balance, hearing, middle ear kind of thing. Could also be the cerebellum, stress in the cerebellum. So we would actually take the paddles and we'd put them on the side of the head like this and stimulate the ear. We'd actually activate the ear, which you've probably experienced. We'd also do it on both sides of the head. So transcranial electromagnetic stimulation, which we've done with Doug, will stimulate the brain. So you put on one on each side of the head, and then you flip it around, go the opposite polarity to stimulate both sides. That will help stimulate the brain. It'll decrease anxiety and depression. It'll help decrease brain fog, which is something that Doug had mentioned as far as he's challenged with. But specifically, next time he comes in, we're going to focus on that left ear and get some energy into that left ear specifically, focus on that side. If the lymphatic system is not draining out, so the ear is plugged, but the ear is plugged because the lymphatics are not draining out, we would then go across the thoracic ducts here, and we would actually stimulate the thoracic duct here. So when you start doing PEMF, it stimulates the muscles, so you've experienced that where you twitch. Okay? So we would then focus on opening those ducts and getting the lymphatic drainage. Always remember, though, you got to check out the system. Like, where's the drain going? Where's the main drain you have to open? So that's why we go over to the liver. Okay? If you don't know where your liver is, it's a triangular organ right through here. So sometimes we put one on the side and on the front. Other times we just stack them in front. This is really good at getting your detox organ stronger. Okay? If your liver is not strong, your immune system is not strong in your liver, it's going to be challenging, right? So, Doug, what did you say the other day? You were at a campfire, and what happened?
I was burning some wood in the backyard, and I felt tingling in my face and also soreness in my knees.
Yeah.
Inflammation.
Right. And so what I shared with Doug earlier is that that's a symptom. What happened was there was too much smoke coming in. His liver couldn't detoxify it fast enough, which then pushed his microbiome in a direction that made him feel weaker, which then stimulated certain microbiome bugs, certain bacteria, molds, fungus, parasites, or viruses in our body to then create a symptom. Okay? But he was smart enough to say, that's really interesting. I was exposed to the smoke, and then I started feeling the tingling in my face and my knees, which is a huge empowerment for him because now he's aware of his symptoms, which before he might have been like, oh, I'm having a relapse, like I'm having a regression, I'm having a Herxheimer reaction, right? Which is something he's experienced ongoing with the different antibiotics he's used. So now we can help him understand that the knees are about uncertainty and inability to move forward with certain things, okay? And then the face, there's different parts of the face as far as needing attention, wanting attention, not getting enough attention, feeling a separation from a love. There's a bunch of different threads we don't need to go into now, but there's always a reason behind every symptom that you experience, and you're in the process of learning that. So my job as the doctor, as the teacher, is to teach Doug what the symptoms are, where they're coming from, how to get rid of them, how to never have them again. So that's the process of the education we're doing. So you are now empowered moving forward, okay? We don't need to go into every symptom, but now you got an idea of how to affect different brain tissues, different kidney tissues, digestive, liver, and stuff like that. We found a connection today with the spleen, so we would stimulate the spleen organ over here. For certain individuals, they have pain in their feet, so we would stack the paddles on the feet over the pad. Okay, I don't know if you can see that. You see that already, Nissa? Okay, fantastic. And depending on different issues, so for example, women that get endometriosis and endometritis, the uterus is the analogous organ to the prostate for the male. So if I had some prostate organ issues, I'm going to drop your legs down. So for example, if I wanted to stimulate my prostate, I would put these in the middle, and then what I would do is I would sit right on them, okay? Sort of ride in the saddle, okay? And that would stimulate right underneath where the prostate is, and that's going to help me detoxify that organ. Because it's really just a filter. It's just going to collect toxins and stuff like that. And so if it gets overburdened by everything, it's going to become a problem. So if you have a symptom, like let's say either one of us or any other male had an enlarged prostate or had a prostate-specific antigen, your PSA, if that was elevated, that would be related to dealing with some type of filter issue. Like there's too many toxins in the body, they're not getting out. But as luck would have it, being males, sometimes we have struggles with females. Okay? So this is like, well, duh. But the prostate is the organ that is related to struggles in our life. And usually because we're males and we typically, depending on your persuasion, we mate with females, we have struggles in those relationships. And it can be a challenge. So that can be affecting us in that adverse way. But I just want to give you an idea, and we're greatly appreciative of Doug to share his experiences and his challenges with us, because it helps empower you to understand that, oh, well, wow, Doug's just like me. I've been experiencing that stuff, brain fog and lack of energy and waking up at night and stuff like that, and feeling unstable and unbalanced. So all of that stuff is very common, and like you said before, you were sharing that a lot of people have been failed by the traditional system and not received the help that they need, right?
That's correct.
And so you've been to a bunch of different doctors, and you got to one at least progressive medical doctor who was probably what you said was the best you had come across.
Yep, he was a Lyme's trained
Yeah.
trained physician.
Yeah. So Lyme literacy is actually a certification people can get. It is governed by the medical body, so they don't allow anybody who's not a medical doctor to get it. But it is important to understand that the basic premise is that antibiotics are the best and only course, and then if you get into chronic Lyme, then you're basically, non-technical term is called SOL. You're out of luck because they can only do so much. And when you understand Borrelia and you understand that it is a tiny little bug that can cross into joints and in the brain and hide from antibiotics, and it can even sense when antibiotics come into your system, then you say, okay, I better find a different tool to support this. And that's why we haven't used, you came in assuming Lyme would be your first issue, right? And you're like, well, I have all the symptoms. But we found it's more viral stress, which is limiting the microbiome, right? It's limiting your overall strength. So we're not certain if Borrelia, the bacteria that's associated with Lyme, will show up, when it'll show up. It's not your primary issue, okay? The detox and the health of the immune system in the liver is the biggest challenge. So as a result, we need to help heal that first. And then, if need be, we'll educate your system on how to deal with the Borrelia bacteria later. But the most important thing to understand with Doug, or any of you, is that you have to educate the immune system on how to deal with it. It's not enough to say, hey, we should just kill it off, right? If your immune system does not have a tool to use afterward, you're not going to be of any help moving forward, right? So I think when we first had our initial consult, I asked you the question, if you give a man a fish, what does he do for a day? Eats for a day. And if I teach a man to fish, what does he do for his life?
For his life.
Yep. So you have to teach your immune system, and you have to understand what you need for your own help to benefit and to heal. Okay, so that's what's most important. So that's why doctor means teacher, and if your doctor is not teaching you how to help yourself, you're not being served. Okay, you're not getting the service you deserve. And then if you don't have a team behind you that can support you in every way, like Doug has, so I'm the teacher. We have a team to support you. So it's like your pit crew in NASCAR, right? Or Indianapolis 500. You pull in the pit, get your tires rotated, get new tires on there, gassed up and fueled on, and on your way. Okay? Or if you need to radio in for help, that's what we're here for. Does that make sense? Yeah. So don't let a diagnosis limit you. Take advice from Doug and have hope, because there is hope for you. Even if you've been told that there's no hope for you, don't let anybody ever take that away from you. The only person that can decide not to have hope is you, right?
That's right.
So you just keep fighting, grinding, and digging, and scratching your way out, and find someone to help you. So once again, we want to thank Doug for sharing his story with us this evening and allowing us to sort of highlight how we use a technology that is really the equivalent of the Earth's healing energy to supercharge his healing process and take his healing time from, well, you've already been at this for 4 years.
That's correct. Four and a half.
Yeah, my job is to cut that down to 4 months or 6 months to say, okay, now I'm feeling like I'm unstoppable. So the goal is always to get you to feel unstoppable, get you enough momentum that you feel like, nope, now I have enough confidence, I know who I am, I know where I'm going, I know every tool I need to know moving forward so that nothing stops me. Does that make sense?
Yeah.
Cool. All right, great. Right, and this is prompting me to reference our Participant Appreciation Week, which is the 16th through the 20th, right? Got it right? Which the 20th will be here from 1 to 6, having different vendors, people that have services that are similar to ours and that we really think complement what we do, then that are going to provide services for you and great opportunities for you to expand your healing process, as well as there'll be food and prizes and raffles and all the other stuff that goes along with it. So be sure to come by at least on the 20th, if not during the entire week, 16th to 20th. I believe there are 20% off supplements and all that other kind of stuff. And, it's going to be a good time. It's our opportunity to give back as far as show our appreciation for you giving us the honor and the pleasure to serve you as our participants and helping you grow and get the most out of life. So we look forward to seeing you then. And thanks again, Doug. And we will see you folks next week for the Wednesday Wellness Minute.